working with horses and his journey with that. So it's a very lovely presentation in the sense that not only is it about coMra, but of course, as we've gone over before, it's also about that coMra journey. And Georg's he's gonna share some of his journey with us through this presentation. I just wanted to say, you know, some of you tune into the webinars regularly. Others of you, maybe it's your first time or you come once in a while, which is all great. I would ask you, when you're watching this webinar, think about the people in your life who you know who it could benefit. And why I say that is, you know, it's not only humans who suffer and go through pain and different things, but you're going to see very clearly from the webinar. And some of you, of course, are familiar with horses, so you'll already know this, but for others, they're also going through their own pain and traumas and different things. And so it's not only people that benefit from coMra therapy, but obviously animals too, all life, because it's a life supportive technology. So Georg is going to present. Keep in mind how this benefits people and our furry family members and other animals and stuff. And if you feel there's someone that could benefit, pass it along, because there's a lot of people right now. You just heard before we started about the lockdown. There's a lot of people in the world right now who have no access to any medical care because they can't go for elective surgeries. They're not wanting to go into places where there's risk. Some people are very concerned about this. So it becomes even more of an issue now about this being able to take care of our own health. So just consider that as you watch the webinar. Okay, thank you. And without further ado, I'd like to welcome Georg. Thank you very much. Georg is our South American representative. He's stationed in Chile. He's originally from South Africa, so he's a well-traveled man. And he's going to share with us today some of his journey with coMra therapy, and especially, as you see here, with respect to horses. So Georg, thank you. Please go ahead.
Thank you, Garrett. And thank you everyone for making the time to come to listen to this talk. So, yes, my name is Georg, and I'm living in Viña del Mar in Chile. And I'd like to share with you my journey in working with and healing horses, and in some aspects also healing myself at the same time. So in 2014, a friend of mine came to me and she shared an opportunity to work with a lady who works with horses and children, and we ended up working with the horses. And this opportunity led me into the unknown, where I had no idea what I was doing at the time, as I had no experiences in working with horses at that time. And the journey eventually ended a year and a half later, where we assisted two students that were working at the local racetrack, where they wrote their theses. The first student wrote their thesis on a condition called exercise-induced pulmonary hemorrhaging. And this condition is prevalent within the race community, and it is a condition that racehorses suffer from worldwide. And due to the high levels of training and demands placed on the horse's lungs, this high level of training actually damages the lungs to the extent that they start bleeding, hence the hemorrhaging. So we did quite a lot of work around this. And during this process, I also started seeing, because we were working with horses quite extensively, we started treating for different conditions, and we ended up treating a couple of wounds. And I started seeing some really amazing results with the wounds. So when we were preparing for the first thesis, I also requested the director of the clinic whether he could find a second student, and we could do some sort of study or get another student to write her thesis on how coMra can assist with superficial wounds. So we ended up doing this second study with dogs and showing the benefits with a couple of patients there. So that's just a bit of background in terms of the journey that was traveled. And we then, in January of that year, I was introduced to Paula, who ran the Equus Center. and it was a rehabilitation center for children with special needs. And she offered complementary therapy, and she also provided the children the experience of riding horses. Some of the children were wheelchair bound. So they would then give these children the opportunity to have a different type of reality. And this was Paula's world. So at the time, we had had some very good results a couple of few years before with the rehabilitation center in the Ukraine. And my idea was to work with the children to see whether we could get further benefits, and from there I could create contacts and also start sharing more about coMra within the medical community. However, Paula said to me, look, before we even think about working with these children, I want to see if your technology can work with my horses. Because her world was her horses. And I was, I'd come to sort of a brick wall in terms of the direction that I wanted to go. So her center was called Equus, and it was based at the local racetrack. I'm just sharing for reference so you have an understanding, because her center was this island, if I can call it that, in this world, this racehorse world, or the race community world. So Equus, I just want to, her center is over here and she used to work with the children in the stables, and she'd have this field where she would work with the children and do therapies with them. And I think within the buildings, they would also have a space for the children to do some cognitive work. On the other side of the dirt road, so this road was used for training horses and a lot of the people, and all of these buildings are stables for the race community, with the exception of this section, which is the clinic. So the clinic would attend public, and mainly dogs and cats would come in from the front entrance from the main street here. And the race community would then bring their animals in, and they would do their examinations and work in this section here. And we also then worked afterwards at a different section, but I'll get to that a bit later at these stables. So this was just to give you a bit of reference in terms of the work, but Paula was working with the children and the horses, and it was like she was a different community relative to the race community as a group of people. So my motivation for the title, or just to give you some further background regarding our motivation and my motivation, the vision of our group at RLT is to pioneer technology that will benefit men and women by claiming their power by becoming ever more holistic in the development of sustainable self-sufficiency. So to become self-sufficient and to help people help themselves. And for further just personal motivation, man's only justification for physical existence is to learn. This is his destiny in which he cannot avoid under any circumstances. So when Paula told me her decision in terms of not wanting to work with coMra and the children before we could get benefits, or before she could see what the technology was about with her horses, I sat there and I sort of tried to figure out, okay, but what was in it for me? Or is there an opportunity for me to learn something here? And so I had to sort of reconsider the whole process, because it was quite easy on first reaction to say, well, you know, I don't have any connection with horses. Let's not continue with this process. But I sat down with the decision that Paula had brought me, and I thought, well, hang on. I then had a realization that I did have some exposure to racehorses. When I was 8 years old, my father had some racehorses, and he took us to go see them. And as children are sort of playing around, I ended up running in and out of the stable, and one of his racehorses kicked me in the forehead, and I ended up being unconscious. I recall people telling me at the time that had the racehorse or they had the horse had shoes on, I would have been killed. So that left me with a bit of, well, it left me with a fear of being around horses. And I also had a further realization that my understanding and perception of horses was based on my exposure with my father having the horses over the years. And a lot of people in the racehorse community treat the horses as objects to be used so they can earn their money. I also saw that horses were seen as beasts of burden, just to put it in a crude term. So I saw in terms of an adjustment, and if I make a conscious choice that I can address this fear, then there would be some sort of benefit for me to continue with this process. So that, for me, was my motivating factor in making the choice. So how we deal with change, so this can be dealt with willingly, or if we resist it, we end up manifesting some diseases. So I decided to explore what was in it for me, and the difference for us, or for me, between being self-centered, where I make my decisions at the cost of everyone else, was that when I include myself in the picture, then we can get that benefit. So once I'd gotten to this point, and I saw that, okay, so I can actually learn how I can behave around horses in a more respectful fashion, then I could also see what Paula was bringing me, and that there was a synergy where she could get benefit with the horses getting better, and I could then get benefit in terms of gaining knowledge of how to get treatments with horses, because we didn't have any experience at the time working with horses and doing treatments. And we know from our research that if our emotional and mental state if the emotional and mental states are left unresolved, this can translate into acute and chronic stress, which then leads to a drain on our natural functioning of our body or our functional reserves. And from further research, the effects that was done with the general activation syndrome by Garkovi, how the effects of different levels of stress can have on our body. When we're in a activation or training state, healing can happen within our immune system supports that. But the moment we switch over into acute and chronic stress, that actually limits the ability of our body to do healing. So by making choices to deal with our levels of stress, we can then maintain our health in good levels. So I started with the treatments with no experience of horses. I entered with lots of nervousness due to the trauma that I mentioned earlier. And also I had no reference. So you can probably see from the photos, most of the pictures where I was working, I was making sure that I had my hand touching the horse to give me time to react if the horse moved in a strange way. And even when I was wanting to greet, I was keeping quite a lot of distance. So my first treatment I was attempting to do from outside the stable, but eventually, because the horse was moving around, it wasn't practical. So Paolo was helping keep the horse under control, and then I would then do the treatments. The communication with horses, which is what I started learning, and Paula started assisting with educating me, was a lot of the communication with horses, because they can't speak, is non-verbal. So horses pick up our levels of stress, our body language, our hand positions, etc. So if I wanted to connect, I needed to be more relaxed. And this is what I slowly learned over time. When we started with the treatments, Paula wanted to see how the results would work out. So we started taking measurements. And at the same time, we also requested a vet, the vet that was in charge of the racetrack. We requested that he come in and give us a diagnosis and point us to where the horses had their ailments, because it was quite difficult for us to do the diagnosis. So we had the vet come in and do the diagnosis. And he then showed us where we were working with 4 horses, where one horse had pain in its lower back and its spine. This horse had an inflammation on its ankle. We had another horse with a problem in its knee, another horse with a problem in its thigh, and the 4th horse had inflammation, like a growth on its stomach. So we started doing the treatments, and over a short period of time, we started seeing that the horses were responding in a very good way. We then also had the vet come back a week later, and what I noticed from when the vet came back the second time, how the horses responded to his diagnosis, that between when he did the first pain test, pressure test on the horse's spine, a week later, instead of flinching from the pain that it had, it was just felt this mild discomfort. And we also started seeing a difference in terms of how they were walking, how they, instead of being nervous. And this horse was an ex-race horse, came from the racehorse community and received a lot of conditioning, coming from a very difficult environment, and was very nervous around people. And Paula was the only person who this horse would respond to in a positive way. Most other people would find it difficult to handle her. And it took a few days for Yvonne was helping me with a lot of the treatments, for her to start doing the treatments, and then she was able to go in without the assistance of a volunteer. We also started noticing that while we were doing the treatments, instead of being nervous, he started falling, or not sleeping, but he would start resting his head on the shoulder and sleeping. So that for us was a good indication of how the horses would respond. We continued working with these horses for a period of 3 months. At the same time, I was also changing my understanding of being around horses and gaining more confidence. During the period, I got to meet what I would term a horse psychologist. There was a gentleman who used to run his courses with the horses, and he would use Paula's horses as a basis to educate the trainers, for the trainers that were willing to work with them. And also a lot of the veterinary students wanted to learn a little bit more about horse psychology and understanding the horses. So Patricia would run a course called Etymologia Equina, which is the psychology of horses. And in his courses, he would share with people what to be aware of with the horses when you would enter the stall, what type of horse or what characteristics the horse had inherently, whether it was, for example, a stubborn horse. And if the horse had that type of characteristic, then you would tailor your strategy in working with the horses and how to relate to them in a better way. So if the horse also had a inherently nervous type of characteristic, or specifically within that environment at the racetrack, where a lot of the horses were hit and the handlers were quite rough with the horses, they also treated the horses with a lot of, I suppose, aggression. So Acurate, this horse that I showed you before, he had a conditioning where, from his years of being a racehorse, the moment you touched him on his rear thigh, where he used to be whipped during the races to make him go faster, he would automatically start kicking out of nervousness. And one of the courses that Patricia did was to desensitize this natural response that Acurate had to his, because people found it difficult to be around him when you would start kicking for no apparent reason. So that was one of the times I was fortunate enough to be when he did the course. He also then took the people out in the field, and if he wanted to connect with a horse while it was amongst other horses, one of the first things to be aware of was who was the alpha in the field. And then what you would do is you would establish yourself as the alpha. So once you then connected and established yourself as the alpha, you could then connect with the horse that you wanted to, as opposed to trying to connect with the horse. So it was being more aware of the psychology or the behavior of the horses and in what conditions created, so that you could get a much better response with the horse that you wanted to relate to. And so I learned a lot, and I gained a lot of confidence. So that was during those first 3 months that we were working with Paula that we got to know those different people. And towards the end of the time, Paula had to relocate, and she moved her stables from the racetrack about 40 kilometers. And during a few days before her move, Mara, you can probably see from the slide, she ended up bashing her head, or catching her head on a nail. And Paula requested whether we could actually help do some treatments with Mara. So during the move, or just before the move and after the move, we went through and treated Mara. And this was one of my first exposures of working with open wounds with animals and treating them with coMra. So I recall from Paula, she was quite concerned. One of the effects of doing the treatments with coMra was that within the first few days, there was a lot of liquid coming out from the wound after treating with coMra. And in the first few days where there was a lot of dead tissue being replaced, we saw a lot of pus or necrotic or dead tissue being expressed. But the moment all of that tissue had been cleaned out from inside and it was expressed outside, then things would change quite a lot within the wound. But Paula was quite concerned with that whole process. So I'd had a friend of mine had shared the process with me that when the immune system is in a heightened repair state, the body then focuses on eliminating any toxins or dead tissue before the repair process can begin. So I was able to explain that to her. And I started paying attention to this benefit, because then once the first phase is done, then from inside, the wound starts filling up, and the granulation starts growing. And then once the wound is filled out, the borders start closing and growing closed. But what I found quite impressive, because the conventional way of dealing with the wounds is to close it up with stitches. Whereas in this case, it wasn't possible. But I also started seeing how the natural response from that process was. And it was also during this time that we met a fellow called Wilfredo, who was a trainer from the race community. And he used to assist Paula with cleaning the stables. Even though he was caring for his own 20 horses, he would come through and assist Paula with these. And he was very impressed with the rate of regeneration that we were getting with Mara. He said he hadn't seen that with all his years of working with racehorses. And I went back to the stables about a month and a half later, or 2 months, to see if I could actually see if there was any scarring. within Mara, and I couldn't find where the wound was. So I was also very impressed. So during that time of doing the treatments and getting to know Wilfredo, he then started asking us, look, can coMra help me with my racehorses? So we got to know Willie. And just after we did the move, because Paula did a move in mid-May, and in June, early June, Wilfredo had told us, listen, I've got this racehorse, and his name is Super Tatan, and he's very nervous. He's very difficult to handle. The owner sent him to me because at the he runs his races, and because of his high states of stress, when he starts his races, he starts off very quickly. But by halfway through the race, he's ending up last. And he has demonstrated that he can win races. So the owner obviously wanted the results. And what was fascinating was, after having met Paula, we met probably what I believe to be the one trainer, in all of Viña, out of all of the trainers that were based at the racetrack, who had what I would term a holistic or applied holistic healing methods to his horses. So he was using homeopathic remedies. And his training methods were also very different to the rest of the training community. So Wilfredo wanted to know whether coMra would have any benefits of treating a horse with stress. And Yvonne started treating Super Tatan. I was sort of dividing my time between treating Mara. So she started with this as an extra project. And within a week and a half, you can see from the photo how Super Tatan is responding and has the level of confidence. So his behavior in the beginning, he would be kicking his stall. The trainers, the handlers couldn't work with him. And one of the big symptoms or big challenges that Willie had was he would take Super Tatan next door to the clinic to do a diagnosis or to get him checked out, to get medication. And they couldn't take him inside because Super Tatan was too nervous to walk down the passageway to enter into the clinic. And after a week and a half, we accompanied Willie and Super Tatan into the clinic, and they were all very impressed because the vets from the clinic would have to wheel out their equipment to do the diagnosis for Super Tatan in the street. And they couldn't believe that we'd managed to get him there with the treatments. So as a further benefit, Willie then requested whether we would like to go with him, accompany him to the race after 2 weeks. And on the race day, 2 weeks later, here's Willie doing the treatment to help Super Tatan for stress. And we were all very excited and very happy with the benefits that we've gotten with Super Tatan. I then also decided to see if I could help him further by treating his muscles in his legs and his thighs to see if we could improve his performance. So from a sports perspective. And the net result was, with him being in a much better state, was that Super Tatan ended up coming first, and he won by two body lengths. So it was his best time ever in his races. So he was all excited. I also had a strong sense of belief in him. And even though I'm not in gambling or sort of into the whole gambling community within the racehorses, I had a strong sense to support him in this race. And I put some money on him. And the odds for Super Tatan were 13-1. So I ended up making enough money to cover some of my expenses for the evening. So we were all excited about that, and the owner was happy, and Willie was also very happy with the results. However, it was a sort of bittersweet time, because we then took Super Tatan. We started becoming more aware of the effects of this condition called the exercise-induced pulmonary hemorrhaging. And one of the checks or controls that they would do to see if the horse wasn't hemorrhaging was they would do an endoscope test where they would insert a tube down its nasal passage. So the tube would be about 60 centimeters long, and it had to have a camera at the end of it. And they would inspect the nasal passages to see if there were any nodules or any damages on the nasal passages. And up until the point they would get down to the lungs to see if there was any blood in the lungs itself. And after the race, we did the test, and I saw that, or we saw from the tests that Super Tatan had hemorrhaged, and it was, I think it was bordering between a level, the most severe case that they allow the horses to continue running is a level 4. That is when it's chronic. A level 5 is there's permanent damage to the horse's lungs, and if it doesn't die, it will never run again after that. So the acute level is level 3, and Super Tatan's diagnosis was between a level 2 and a level 3. But we weren't treating him specifically for the condition at that time. But Willie mentioned that this was something that was a big concern and is experienced within the whole racing community worldwide. The one thing that they do to manage the condition, because there is no cure for this, where the race community keep on training, keep the horses running and training at very, very high levels. So if the horse is not performing, then it's not making money for the owners. So unfortunately, this is just the world that they're operating in. So as a result of this exam, I went from being very happy for Super Tatan to being very upset, because by doing treatments to increase his performance, I was contributing to the harsh conditions that he was. So I decided, while I can be of assistance to do treatments in that difficult environment, I didn't want to contribute to creating his condition even worse. So Willie then started talking to us about doing further studies with this condition, and we started exploring this further. The other thing that happened at that race was that Super Tatan ended up hitting both of his rear legs on a piece of metal during the race, and he ended up gashing his ankle quite badly. And we also started working with this wound, so I started exploring a bit more with regards to the wounds, and at the same time I also started treating my pets. As we were getting great benefits with the horses, I started doing some treatments at home when my dogs were getting into fights, etc. So I started getting great results. And one of the further thing that I started noticing, that as the wounds were growing closed, they were filling up. There started this white, waxy substance on the edges that would start forming on the edges, and you see that. And this first photo was 2 weeks after the event, after race day, and this is a month and a half. And then we're sitting at 2 months after. So what would happen with this white substance, it was like a white waxy substance, and after it fell away, there would be new skin appearing underneath us. And I started seeing really good results, because the conventional thought process is there'd be scarring if it wasn't dealt with. But with these wounds that were being left, and what we were doing is we were just keeping the wound clean, and then putting a bandage over it during the day. And then we would do coMra treatments when we were doing the changes of the bandages. So there'd be no medication, no infections, and the wound eventually would grow closed with no scarring. And for me, that was just amazing, because the standard, as I mentioned earlier, the standard training or standard way of dealing with this is lots of medication, stitch it up. But in this location, it wouldn't support, because it was consistently supernaturally be moving. And the sad thing for me was that they bought him, they started training him again a month after he received this wound, because the owner wanted to see further results. So Willie had no other option but to keep him exercised. And because he was moving, and this was in the ankle joint, you couldn't really put any stitches in that location. But with coMra, the benefits were really, really good. So Willie continued talking to us about doing some work with the exercise-induced pulmonary hemorrhaging. And what he then did is he said, look, I have a very good connection with the director at the clinic next door. How about if we can get, I said, well, if we can get some students to do a thesis on this, this would be fantastic. So we went and talked to the director, and he said and he didn't have enough data and reference to be able to motivate a student to write their thesis on this. And he said what he would do was, if we were prepared to do some work beforehand and in preparation, so that he could then present it to his colleagues, he would offer the services of the clinic to do the endoscopes, because they would normally charge the trainers and to do the endoscopes and the tests. So he said whatever tests and preparation we needed to do, he would not charge for these services. So we then started a 3 months process worth of treatments. And in my research of the condition, it worked out that where the saddle was located, when they were doing the autopsies on the horses that had actually died from this condition, this area was where they were manifesting the highest level of damage to the lungs. So we focused, initially started trying to do treatments in this area, because this for me was the closest and better reach towards the lungs, but it turned out that this was the area of the biggest damage. So we then changed and we made 5 points on either side of the spine, and we were treating this during these 3 months, and the results that we got were very, very good. The horses that we treated all reduced their levels of hemorrhaging and improved. And as a result of these benefits, the director then requested one of his students to prepare and write the thesis. So for the study, we then selected 9 horses, and unfortunately 2 of the horses ended up being disqualified. So we ended up over a 3-month period of repeating the work that we've done with Willie's horses. We selected another 7 horses, and we did the treatments in a more comprehensive fashion. And we treated the first batch for a period of 30 days, and then we gave a 2-week break between the treatments. And this is us doing some of the endoscope tests. So the camera was inserted in the nostril down to the lungs. And this would be done normally on the days that they were training. They would have their preparation race on a Saturday, and we would review to see the levels of hemorrhaging then. And then also after races, we would also do the test for any of the horses that were doing their races. And that way we'd actually be able to see whether the hemorrhaging improved or not. So based on the resources available, we did the best that we could, and we were doing each horse 28 minutes. My initial desire when I first set up and designed the treatment protocol was to do treatments twice a day, because it was quite the horses would exercise twice a day. But it just wasn't practical, and we didn't have enough people and volunteers to do treatments on a more regular basis. So the diagnosis or the end result of what was presented in the thesis, and the student received very good results and very good marks, commendations for his work. these were the patients that we dealt with. So there were 7 of them from different ages. And the diagnosis at the start of the treatment were either acute or chronic. So we were looking at basically from 1 to 4, with 5, the horses wouldn't even be able to run. So we started seeing, after the first cycle, we started seeing more changes and more benefits and improvements with the horses. We only had this one patient who was very nervous, who didn't show any changes, and I would like to have done a bit more research with the horse, but again, we were limited in terms of access to horses at the time. It worked out quite difficult when we were doing the treatments, because the director requested for volunteers, for people who were willing to make the horses available to do the treatments. And the trainers that initially started cooperating with us were fine to begin with, but as the work progressed, they became less cooperative, and we ended up having to try and get access to the stables where they were locked. Whereas when we were working with Willie's horses, we had ready access because he was actually seeing the benefits with us. So the diagnosis after the second cycle, we ended up showing 6 of the 7 horses marked improvement with this condition, where the way that they manage this condition is they give the horses diuretics. And the result with the diuretics is that it reduces the pressure on the lungs of the horses. And it minimizes the amount of blood that comes out. So the way that they actually deal with it is if the horse is bleeding, and it's all consequential or reactive as opposed to being proactive. Very few of the trainers will go and declare that the horses have got it. It's become mandatory for the trainers now to make sure that the horses get their exams after the races. And if the horses goes past a certain level, then they're disqualified. At the time we were doing the work in the study, they were allowed in Chile, and in some countries they don't allow the trainers to give the horses diuretics because it skews the results, and it also keeps the horses performing for a lot longer than what they are allowed to. So in Chile, at the time we did the study, they were giving 20 cc's of diuretics. There would be 10 cc's a day before in the morning, and just before the race, they would give another 10 cc's. A year after we finished the study, the law changed in Chile that they would only allow 10 cc's. So they would do 5 cc's and 5 cc's. And this ended up disqualifying a lot of the older horses. So Chandel was one of the horses, and he was about 8 years compared to these horses that we were doing in the studies. And still, we showed very, very good results with that. So from a treatment point of view, what we were doing when we were doing treatments with Super Tatan and the stress, when we were treating the muscle changes and when we were treating wounds and the trauma, is we would take the treatments from the user guide that we have, and we would adapt the treatment points and the treatment times and the penetrations so that the horses would get the benefits, and we would then start seeing the results, especially like the wounds. So when one would scan over the wound, I would also just guide myself, and then I would do, depending on the size of the wound, if it was a really big wound, we would scan over the surface area. And then on the borders, we would make sure that we would scan those areas too. And where we would require a little bit more penetration, we would change the frequencies according to that around the borders. To get, and if it was a deep wound, we would change the penetration level so we can get it at a much deeper penetration to assist with the tissue regeneration. For stress, we adapted the universal 5 treatments and used a lot of those points. that we had to have in the user guide for stress, and then change the time slightly because the blood treatment to get to some of the arteries that we have with a horse, it's a little bit more difficult. So the arteries in the necks are a lot longer, so I extended the treatment times to do the blood aeration around the neck. So that was pretty much the experiences that I had and the results that I was having with the horses. What changed for me personally with the knowledge, so this is a photo I shared earlier on the left with when I started the treatments, and the photo on the right is when we went to go and do some treatments for Super Tatan, and I was doing a blood irradiation treatment for him, and I had enough confidence to go out and spend some time with him, and he was also very he had enough trust in me. And the funny thing was that while I was treating him, his friends that were out in the field came over and wanted to see what I was doing with this. What's this strange fellow doing, and what's he doing to you? So they were also very relaxed. There was no concern. I saw from their body languages, normally when there's a threat, the horse's ears will go back. And you can see in the photos, there's more, they curious to see what is going on with this whole process. And again, in the beginning, we would have a volunteer to assist so we could continue doing the treatments, whereas in treating this wound I had, that was in July. So I started the first one, it was in February. And in July, I had enough confidence around Super Tatan to be able to do the treatment on my own. So I had enough belief in myself and my knowledge and my understanding how to relate to horses in a much better way. Thank you for taking the time to listen. And if there's any questions.
Great presentation, Georg. Thank you very much.
Thank you.
I really enjoyed your personal journey in it as well. I have a couple of questions just to get us started. So with Super Tatan, that wound, just for a reference, because it looks like all the flesh is off and that's like the subdermal tissue there. Is that the case, or is it like, it looks like a really deep wound, but I can't really tell from that picture.
Yes, so it was.
It wasn't like just a scrape and the skin is still there. The skin is actually peeled off there. And is that correct?
That is correct. If you want, I'll just give you a reference.
It's fine. I just wanted to make sure.
Yes, no, it was a deep wound.
And so the skin actually grew back, like from no skin over that area, the skin actually grew back into that place.
Yes, yes. See, I might have another photo which you can see. It's not a good quality photo, but I'll just put it across.
Sure.
But I didn't want to get too caught up.
It's just, it's hard to know the context.
Too much data, yes.
Yeah, how serious is the wound, or
So this was the wound on the night. Can you see that on the screen?
Yes.
So that was, I mean, you know, obviously the size of the coMra terminal, and that was quite deep within the as a starting point. And
so all that tissue is what came out of there. All of that to get
so the
down
first
to
few
that.
days he was expressing a lot of pus, and I think this one you can also see that there's this cavity, and it was also, this is now happened on the 14th, so this is on June, about a week and a bit later. So there's a cavity over here. And while it was working with that, it was basically all filling out. So eventually, so it was quite a deep wound, and there was a lot of regeneration going through the process. And often what we would see after the treatments was that the wound would start seeping a liquid. as I mentioned earlier. And this continued right throughout the process. So it would normally be a lot more active after coMra was applied. And for me, I saw this as a good sign, because then anything that was affecting it would be expressed. So there would be no possibility of anything, any toxins or dirty tissue staying inside.
Thank you very much. Great. Anyone have any questions for Georg with respect to horses, animals?
Yes, I'm Rowan from South Africa. I don't know if I can ask a few questions.
Please go ahead. What's your name, please? Sorry, I didn't catch you.
Rowan.
Go ahead, Rowan.
Hello, Rowan.
Sure. So I've kind of new to coMra, but I've worked with horses for the past 38 years in terms of jumping and playing polo, and I've seen a lot of the way people, and racing industry as well. So what I'm trying to do is introduce coMra to the South African racing and polo industry, because obviously there's a lack of treatment that is good for the horses. So my concern, or my question maybe, is more about when you're dealing with the horses. So I'm still a little bit confused about when you're treating open wounds and exactly how you're taking it from the human experience to the equine experience. I mean, so with that open wound that you just showed us now, were you covering the unit with a cling wrap, or you just placing it slightly above the wound and treating it on a 5 frequency or a variable frequency? I'm a little bit,
Okay.
I'd just like a bit of clarification.
Sure. Rowan, when I was doing the treatment at the time, what I would do was that I would use my thumb on the side of the wound as a guide to base myself, to stabilize the terminal. And then I would keep the terminal as close as I could to the wound. So it'd be about 1 to 2 millimeters away from that wound. And then I'd move my hand slowly around that. If one is concerned in terms of the terminal getting any dirt on it, one can put some cling wrap over the terminal. Then in the scanning and the movement of the terminal over the area of the wound, I would, depending on the size of the wound, so that wound would be probably about that big, and I would work about 2 minutes per frequency. So I would start at 1,000 hertz, which would be all of the superficial stuff. And then because it was a deep one, I would change the frequency and repeat those 2 minutes at 50 hertz. And then that depth section, I would do another minute or two at 5 hertz to get the deeper penetration.
On the center of the wound you're talking about?
Yes, yes,
okay.
Because there would be more damage in the center. But then around the borders of the wound for the skin, I would also do 2 minutes at a 50 to cover that whole area. And often when the scanning is, I found the tendency for people when they scan the wound, they'd sort of scan it like this. But when I scan it, I would almost keep it stationary for 10 seconds, move it for another 10 seconds, keep it stationary, so that I would try and keep the laser covered, but in one place, so that the laser would be working and getting its benefit in that area specifically for a longer period of time, because it takes time for the cells to, the attempts that the cell is then trying to create the energy or the regeneration. If the laser is there to support it for a longer period of time, then it has a better success rate, in my understanding. I know it's not necessary, but it's just my quirk that I've learned over the time. And I found that those results have been pretty good. So it was changing the frequencies, doing it. And if it's a really big wound, we had a dog that had a piece of skin taken out of its back. And that was 18 centimeters by 16 centimeters. And we had really, really good results. I mean, that wound grew down to a piece of skin. And it was skin. It wasn't scarring, which I find really impressive. And so in that section where there was no skin, we would scan over that. And that would be a 5-8 minute scan, because it was a much bigger surface area to scan. And then the borders, we would also scan that for a longer period of time at 50 hertz, so that the skin could attach to the muscles and the deeper tissue underneath.
Okay, great. Thank you for that.
And if I may add to Rowan, thank you for your question. And if you're in a situation where you can treat multiple times a day, let's say you're the person who caretakes for this particular horse, just like with a person, if you can do multiple treatments per day, that wound will heal that much quicker. So let's say, okay, you said equestrian, jumps and these kind of things, and this scuffed for, I don't know horse terminology, sorry. Yes, thank you. So let's say it's a weekend competition and it happens on a Friday and there's more stuff to do on a Sunday. If you can treat, let's say 4 to 5 times in a day, I mean, we've seen wounds that required a lot of stitches. You could almost watch them close up, like not quite, but very fast. So if you have that ability to do that, if you're in that situation, great. Georg, in the situation he's in, he could only do it periodically. So yeah, just wanted to add that. Thank you.
Well, Gerrit, if I can expand on that.
Please.
I had a situation while we were working when Paula had moved the horses from the racetrack to the new stables. And I went through to do the treatments. One of the horses, I wasn't paying attention, so I learned a little hard lesson. This specific stable, the entrance of the stable had a step down. So my head was level with the horse's head. And when I turned my head, the horse bit me and it grabbed my lower lip. And I thought that I'd lost a piece of my lip and there was just blood coming out everywhere. And I went and sat in my car and I looked in the mirror and I thought, oh, okay, so at least now I have I still have my lip. And in that scenario, I treated myself on an hourly basis. And within 4 or 5 days, I couldn't even, this tissue is not very difficult. It's not tough to do regeneration. It's not the same as bone or other stuff, but it certainly made a huge difference. And within 4 or 5 days, it was practically gone.
Okay, wow. Can we ask more questions? Is it?
Yeah,
sure.
Please.
By all means.
What are we doing? Sorry, I've got a lot of things with the equine here. Also, when you're treating the lungs, and so I'm still not 100% sure. So if I'm taking the user guide, so from humans to equines, we're almost just doubling or tripling the time span. And again, with you saying you went from 1,000 to 50 to 5 hertz, is there a reason why you're not using it on the variable, like around the tissue? So say that the average protocol for the back pain for a human, so you're scanning on a variable up and down, and then you're doing like at the 4 places around the actual wound, and then on the wound doing the 50 and the 5. So when you were explaining earlier about where you're treating the lungs at the higher position on the equine, so to get my head around it, I would imagine that you would scan from the wither down the spine on a variable setting, and then come back to the issue of pain on variable around the sections again, and then the actual point of pain doing the 50 and the 5.
Okay, what we decided for those was we selected 5 points. And the difference between leaving the laser sort of stationary for a period of time as opposed to scanning. One of the benefits for me with the scanning, when you're doing it along the spine, is there's a lot of nerve points. So those nerve points are superficial when you're scanning along the spine, and you don't need a lot of penetration. And the variable is also changing its depth of penetration between 5, 50, and 2 millimeters. So you're getting this wave, but because it's also constantly changing, you're not getting that focused, specifically depth. And because the lungs are a lot deeper, to get a deeper penetration, we decided to treat those 5 points at 5 hertz to get a deeper penetration. And we use those 5 stationary points. So there's not, and I'm saying just from personal exploration, it's not that it has to be that way, but if one then wants to do this scanning on the spine, by all means, yes, you can do what you suggest, but based on that, you're getting the benefits of activating all those nerve points that correspond to different aspects within the body. Okay. So blood irradiation also we treat for a specific frequency because it has a better compatibility with the rhythm of the heart. So we keep that on 5. But in terms of the other conditions with the wounds, if you start seeing results with different frequencies and you prefer using that and you find that you get better results with that, then by all means do it.
Well, I'm totally new, so I'm just
in
terms of
I understand
taking the treatment. And I was wondering then, so your studies, are you going to is there a way for us to read something like your student's thesis? Could you make that available for us to read? Would that be a possibility, just so we've got some reference? Or like, and your points that you've discovered with the lungs, would you make that a public issue for us?
What we're going to be doing, we were talking about it and preparing for this presentation, because we'd like to expand our community, the coMra community, with horses. And what will probably happen is that we will start gathering a lot of experiences together to be able to collate and put together a user guide for horses. So we have a couple of treatments that we've already got sort of to form a rudimentary structure for the user guide. And the idea is then to create a group where people can start sharing their experiences within the coMra community.
Oh, great.
I have these documents in Spanish at the moment, and I have no problem sharing them. I just need to find someone who's willing to do the translation. I will come back to you on that one, Ro.
Oh, great. Thank you very much.
Can I come in for a question?
Yes.
Okay. The wound looks very clean.
Yes.
And so in keeping it clean, did you have to keep it covered at all?
Yes.
Yes.
So we would bandage the legs, and then when we would change the bandages in the wound, there would be a cleaning process, and we would use a saline solution to clean the wound. And after that, we would then do the coMra treatment, and then we would rebandage the leg.
Okay.
And that continued for...
Because I'm not going to be dealing with horses. I'm going to be dealing with people.
Yes. What Willie used was a cream. He had some sort of homeopathic cream. And in Chile, because Chile is also a big copper export, there's a product that's used in the horse community called coMra. And it has a base of copper fibers or something that also has certain properties for benefits. So they were using this as a cream to, like a gel to put on top of it to keep it closed, but then we would do the cleaning process afterwards, and that would happen once or twice a day depending on the availability of people. So
did the bandage actually touch the wound then, or did you somehow keep it up?
We had a what do they call it, a patch. So the cream would be applied to the patch, and then that would go on top of the wound, and then they would strap the wound.
Okay. Because it gets stuck on there and everything if you don't have something to,
Which is why they use the cream, so that when we would take the patch off, it wouldn't actually get stuck. The cream itself would be, it's almost like a, what do you call it, like a Vaseline texture.
So, okay. So, well, I really appreciated your experience with horses, because I was raised with horses mashing me against the stall and everything and throwing me off. So I appreciate your experience. Thank you.
Thank you.
Georg, it's Denise here.
Hi, Denise.
Hi. I wanted to ask you, would you start with 5 Hertz first in order to help bring up any deeper infection that might be happening, or would that be a basis for treating in general, where you start with 5 instead of 1,000, or does it matter?
Not necessarily. Normally with wounds, I always do blood treatment. So for me, the important thing with the blood treatment is that it activates the immune system. And the moment the immune system is heightened or is in a heightened active state, then the immune system handles all of that elimination and getting rid of the toxins naturally. Okay. The focus at the site of the wound, depending on how severe and how deep it is, that would determine the penetration. So I wasn't too concerned whether we start with 50 or 5 or 1,000, and then go through the cycle, as long as I covered the 3 different frequencies when I was doing that treatment. But if it was in a leg, then I would make sure that I treated the arteries in the leg, and then I would also do the treatment in the neck, to make sure that we do comprehensive treatment. And also, if there was an assessment that the horse wasn't in a good state, So if it was infected or wasn't feeling well, I remember with Mara, when we moved her to the new stables, those new stables were damp and it wasn't ideal conditions for horses to be kept in. So we had to be very aware of keeping her in a good state, because if she went into a low energy state, then she could become more susceptible to getting infections. But it didn't work out that way. Paolo was very concerned about that. So we monitored it and we made sure that the common treatments, and we kept her wound very good, and it worked out with a good result. So 5, if that's your preference. But my sense is that when one is doing the blood treatments together with, or the stress treatments together with, you're getting a lot of those benefits anyway. And then the wound will sort itself out, because the immune system is the important thing that is going to direct what needs to happen within that wound. And one of the things I found out with wounds and with coMra is that the conventional people teach that wounds will have two results, or two ways of two solutions, I think, coming up from the wound. Or two. One is when the wound is in what they call a regenerative phase, and then they're concerned to prevent the second phase, which is what they call the scarring or the fibrosis, is when the scarring happens. And to prevent that from happening is when they do the closing of the wound. What I saw with coMra is that part doesn't happen. The regenerative aspect stays active for a lot longer than what would happen in normal if there wasn't a coMra around. And that is because the immune system is directing all of that process.
Right. Okay. Thanks. Yeah. Then the other question I had was with Super Tatan. Before, when you first started working with him, were you doing coMra on the lungs as well, or was it just in the areas of his muscles, and I can't remember what other?
Yes. The first 2 weeks, we focused only on, we adapted Universal 5. So all of the points that you would find in Universal 5, which are points in the head, the 2 points in the back, we did the blood radiation. There were some points in his chest, and then his kidneys. And that was all we did for those first 2 weeks. And that photo that I showed Willie doing treatments, he was actually finishing off the treatment on his kidneys. That was yeah.
So do you think, I mean, knowing that his lungs were not in a good way afterwards, do you think that treating the whole body, or treating every aspect in that particular situation, would have strengthened his lungs and given him more capacity to well, maybe not regenerate, but not produce the kind of inflammation in his lungs as happened afterwards?
The challenge with the condition is that when sports and people, and I think this condition also occurs within the endurance, where they do long distance races with horses, is that within that world where they force the horses to train at levels that are beyond their capacity,
Oh, yeah.
and they can't continue going, then the damage happens. I say that there is no cure while the horses are active. They've actually proven that if they give the horses time to rest, and it's about 2 months worth of rest period, that the hemorrhaging actually can reduce and get a bit better. But in that world, the horses are training 6 days a week, and they have their pre-race. When we were doing the treatments, I had to weigh up the being in that industry. And I say the industry because it was a business. So it was a result-based business. So if the horse was performing, then they were happy and they would do what they could at call it a superficial level. If the horse wasn't performing, then they wanted to do what they could to get it to perform better. So I didn't want to propagate that side of things. But when we were doing the preparation, so we had a 3, maybe a bit longer, because we were doing the wound, and then we started treating August through to December. 3 of Willie's horses, and Super Tatan was one of the horses that we were treating for the condition. We would focus also in including some of the treatments for stress. And I found that while we were doing the treatments, and it was at least half an hour worth of treatments with the horses that we were doing, and with Willie's horses, I think we were doing it twice a day, where possible, that the horses were receiving a very different type of attention and care that they would have, where the handlers would come in, they would take them out, they would run them, they would feed them, they would clean the stall, and it would be a very impersonal process. And if the horse was aggressive towards the handler, then they would give it the same level of aggression. So there was no care given to those horses. During the times that we started doing the coMra treatments, we found that the horses would respond to us in a very, very different way. Yeah. And that also had a big impact. However, we still had to deal within that industry and what the requirements from the owners, because if the owner didn't give us permission to continue working with his horse, then we couldn't continue.
Yeah, it's a I find it quite painful to listen to what happens to racehorses, but yes. I am working with somebody at the moment in the UK who have a lot of racehorses, and so maybe I can communicate with you on that, or send you or send them your details on that.
Sure, by all means.
Interested in working.
For me, the decision is choosing between whether we can actually help the horses, or I can let my principles get in the way. And I'd much rather be of service. I'm certainly going to, Garrett is going to be doing a talk on sports. So if I'm a willing participant in a sports event, and I make that choice to participate, and then something happens as a consequence of that, then that is my responsibility. But if I'm in this industry going to make the condition situation worse where there is no agreement, then I then have a choice to say, well, either I'm going to make it worse, or I can deal with the situation and still make a difference. And then, the intelligent cooperation between the time that we spent with Willie and with Paula was that we were able to make a difference. And we then got these results as a consequence of it. So I could have let my principles get in the way, or get the experience and get the knowledge out of it. So sure, I grew up with the racehorse industry as well in South Africa. My father had horses in Durban. And we sort of dealt with the consequence of this whole gambling mentality.
Yeah. Well, thank you. It was good.
Sure. Thank you, Dennis.
I have another question, if that's okay.
Yes.
Can you hear me? Okay.
Yes,
now it sounds as if you're dealing also with emotions with both yourself and the horse. Do you do that consciously, or do they just develop as a result of the treatments?
In any scenario speaking for myself, between two beings, if you deal with it in a caring way, then I believe that your results will show those benefits. I found that out of the times when I was reacting to situations out of fear, and I expressed aggression towards people or scenarios and with animals, and I've had dogs and pets over the years, and the times that I expressed any aggression towards the pets or people, I then started getting the reaction, the response. So either it was a fear response or an aggression response mirrored back to me. But if I took the time to understand that being, and I treated it with care and with love, then the horses would respond in kind. Because in essence, we are all beings inhabiting different bodies, where the horses are inhabiting different bodies as spirits. We as spirits are also inhabiting human bodies. And we all like to receive what we would like to be treated in return.
Because I found myself that rather than dwelling on the event that caused the problem, dealing with the, say, the fear or the anger or whatever it is.
Exactly.
Themselves, rather than then the event doesn't really matter. It's gone and done with. It's the emotion there.
Correct.
So
And
dealing with that in particular.
yes.
And I see that I thought that's what you were doing when you were getting used to the horse and getting the horse used to you.
Exactly. Well, I had two challenges. First of all, for me, the main fear was because I had kept that as a program in myself. And I then live my life according to that program. So by starting the project, I decided, okay, now I can actually change this program. That was called it the first step, was getting that sorted within myself. Then the second step was, okay, now I'm dealing within a world that I have absolutely no knowledge, no experience, and no reference. So the first thing was, okay, I need to deal with that because I'm in the unknown. And by dealing in the unknown, I need to get some sort of direction or some sort of guidance. And the way that I got the guidance was Paula had a lot of knowledge and experience of working with horses. And then fortunately, I managed to meet this horse psychologist who also imparted his knowledge. And that then gave me the tools how to navigate in this unknown world. And instead of letting my fear overcome me, I could use that guidance to take action with those horses and deal with that fear.
Yeah. Another thing that I've found is dealing with scars. They have a great deal to do with how you feel.
Yes.
And in using, I had dealt with scars in other methods before, but since using coMra, I have about a 6-inch scar on my abdomen that's been there for 70 years. And it's, I can hardly feel it now. It's as if it's all thrown together. I'm going blind, so I can't really see what it's doing, but I can feel it.
Okay. I firmly believe that the patient, when they make a conscious decision to participate in the healing process, then that gets resolved. And coMra also helps deal a lot with that. And one of the benefits I've seen a lot is that with coMra, you need to make time for your treatments. And by making that time, you're also making time for yourself to reduce your stress levels, etc.
All right. Thank you so much. I really appreciate your information. Thank you.
Thank you.
Could I jump in and ask 2 more questions quickly, if you don't mind?
Yes, please.
Sorry, I don't want to hog. I just really interested in the fact. So when you were dealing with those racehorses, one of the things that I found that is quite common, I don't know if you've been able to treat it, is most of the racehorses turn into roarers and get normally on the left-hand side, the partial paralysis of the left larynx, and they become roarers. And that's kind of, you kind of touched on that. This would be the end effect of the condition. So the long nerve ending obviously makes that like a partial or full paralysis of the left larynx. Did you have an effect on that when you treated?
That condition, the terminology is a bit different because being in Chile, we dealt a lot with whatever medical terminology in Spanish. So I'm not familiar with that condition, and I'm not sure if we've actually treated that one, but all the conditions that we worked with, certainly we did have benefits.
So when they get the bleeding on the lungs, so what normally happens is when the horses are training and running really fast, they almost sound like a whistling or a roaring effect.
Yes.
So that's normally what happens is, and generally on the left-hand side, not sometimes on the right-hand side, it almost gets a partial or full paralysis of that larynx. And that's why they normally bleed.
Okay. So the treatments that we did with the horses on the lungs, with the exception of one horse, was inherently stressed and nervous. And I wanted to get more time with this horse, but unfortunately the owner and the trainer wasn't very cooperative. But
Was
the
that
time
your number 5 that you were saying?
Sorry?
Was that the number 5 on your schedule you were saying that you didn't
Correct.
have to?
Correct.
Okay.
Correct. He was extremely nervous as a horse. And, you know, we found most cases with the horses when we were doing treatments, they became more relaxed and less stressed. The grades and levels of bleeding, because we were doing the endoscope tests on a weekly basis, if not twice a week. while we were preparing for the thesis, and also during the time that we were doing the thesis as well. So it was over 6 months that we were continuously doing the endoscopes, and we were improving the results, that we were minimizing the bleeding within the lungs.
Okay, so that probably did have that effect. And then the
Yes.
last question I have on that, and on the tendons, with the flexi tendons down to the fetlocks, they normally get that bowed tendon, or the hardening of that tendon, which I've seen between like the 2 and when they take them to the track, and just kind of to 4 or 5-year-olds when they're coming off the track, they generally get, broadly speaking, they're coming off with those superficial flexi tendons and the bowed tendons that are hardened. Have you had any experience with that?
No, not too much, no. We did some treatments in terms of movements with the horses, but a lot of that was also affected by the levels of exercise that the trainers would do. So if they kept them in those conditions after they started manifesting those conditions, then the horses would not really show too much benefit. But if they allowed the horses some time for recuperation, where one would do the treatments, then sure, you would get some good benefits with that. Okay.
And again, you'd use the same sort of protocol. You'd use the 5 around that whole area of the tension in the fetlock.
Yes,
and then
the 550 and variable probably.
Okay, and then like we do like in the elbows and stuff with humans, would you take it up to the knee? So down just under the fetlock, then over up the tendons to the knee, sort of behind the knee, to get the blood irritation?
You'd find the artery inside the leg, if the horses would allow you to work with that one. And you could probably do from 2 to 5 minutes on that. And then in that zone, you would look at doing the treatments with the different frequencies, yes. And you would pick up a couple of points.
So the artery you're doing at a 5 as well?
Yes, the blood is always done at 5 hits, yeah.
Okay, sure, thank you.
And that would just vary the amount of time you would do it, depending on the condition and how long the horse has had it, or how severe the condition is.
Okay, great. Thank you very much for that.
Okay.
I have a question. Well, first a comment, Georg. Thank you so much. There's so many parallels to human psychology and horses. I know a lot of people here use horses to heal human psychology, and it's very gratifying to see it working both ways in the study that you did. And one thought went through my mind is, were you always the person treating, or were the horses treating you? When were they
Yes.
exchanging their gifts? And so it was very heartwarming and touching, and it is hard not to sort of get pulled into the unfairness of it, but that's the human condition, isn't it? But what I did want to ask you, I'm really curious about the scarring versus healing principles and what coMra does to encourage really regeneration, not just haphazard scarring. I think this is really key for human, to translate that to the human situation, because what I know from scars is they can hold a lot of trauma, or they can keep a lot of unresolved issue in the body, a lot of it emotional. So the fact that there's no scarring, I think, is really, really important piece that sometimes maybe gets literally covered over when we stitch wounds, or we hurry up and close them, and we try and get on. Yeah, so I'd like you to you can speak to that, and you may. And I have one last question: is, did you ever get to the kids? Did you get back to treating the kids? You know, at the beginning, where Paula didn't want you to treat the kids until
no.
Yeah.
No,
So I'll leave you with those.
Unfortunately, when Paula did the move, she was also having certain challenges with her daughter, who had the special needs, and she had to go to Argentina, and she ended up moving to Argentina for about 2 years after that, where the daughter's father had better access to medical care in Argentina, so she moved to that location, and she left the horses in care of a friend. So it just, as much as we wanted to continue with that whole side of things, we were sort of keeping the focus at the racetrack, and that whole was keeping us quite busy. And Paula stopped her therapy. Her connection with the community, with the children with special needs, was based on the community that she lived in. And a lot of the parents that she gotten to know started asking, and she started sharing the benefits of the children working with her. So because the center then in essence closed down, we didn't get the opportunity to continue, as much as I would like to have done that further. In terms of the regeneration side of things, I also did some research in terms of what is taught conventionally, and I found out about the fibrosis. And I agree with you in terms of it makes a lot of sense that if one allows that wound to heal naturally, it is also an emotional side. If there is some sort of emotional component to that, then that needs to be dealt with at the same time. So I firmly believe that it needs a willing participant as part of that healing process where we talk about the scarring. And if one is then willing to deal with that, then the growth and the new life will happen as a result of it. And sure, I saw that. And we also saw that because while we were working with the horses, we had a young lady who was doing a study with a couple of dogs. And to have a wound this big on the dog's back, one of the things I found very fascinating was that just got a dog who'd already been in for a month, who was a bit smaller, but also a fox terrier who'd had a piece of its skin ripped off and was attacked by other dogs. And this fox terrier, what I was told that the conventional healing process with these types of wounds where the skin has been removed is that the vets will stitch the edges of the skin so that the skin will attach to the deeper tissue. And the normal process for this attachment, once they've done the operation and they've stitched the skin, it takes up to 1 month until that skin is then attached. We then had this other dog that came in, and there was no operation done. And within 9 days, the skin started attaching with no stitching. It was just with coMra treatments. And that for me was just phenomenal in terms of seeing that. And the skin then attached, it grew closed. And the fox terrier, they were about to do a second operation. And the young lady then treated this fox terrier with coMra, and they didn't need to do the operation with the fox terrier as well. So I was really, really impressed with that in terms of the benefits. And the experiences that we got in terms of dealing with the patients certainly were very rewarding. I met some very interesting characters amongst the horses, really funny horses that had a good sense of humor. And there were other horses that were also very difficult to be around, but one was able to take the good with the bad. And I had one horse that every time I came, he used to stick his tongue out at me. And I used to sit and have a laugh at him, but he was, and we used to have long conversations. So I really learned to relate to the horses and connect with them in a very, very different way, especially. Today, I can't claim any expertise or knowledge riding horses. It was quite funny because we'd done all this work, and it was after about 9 months where I think it was Yvonne or some of the other horse people said, well, would you like to ride the horse? I said, I don't know how to ride a horse. So they offered to teach me. I said, look, it's not really what we're doing, but at the end of the day, if I ever get to that side of things and get a horse or have a farm, then we'll concern ourselves about riding the horses. But right now, I'm just focusing on how to relate to the horses at first and seeing how we can help them. So that was...
Well, it's a lovely story. Thank you for sharing it. I learned a lot.
Thank you.
Thank you.
Georg, I have one, just a technical question with the 7 horses treated for the exercise-induced pulmonary hemorrhage. In your chart, the second, the first one is around 28 days, 30 days for the first cycle. And in the second cycle, the numbers are a lot larger. Does that include the first cycle with the second cycle?
Yes, there was the total
Okay.
days of treatment.
Okay.
So we did the first cycle of 30 days, and the second cycle we did a shorter period, but he added the 2 cycles together. So just to show
Thank
how
you.
long we did the total treatments for.
Okay, that's clear now. And then this is just a comment. Rowan, you talked about you're new to coMra, and you'd said scanning with the variable. Generally in the user guide, just as a note, scanning is done at 1,000 hertz. So that's just, I just wanted to clarify that. Not that you can't use variable, by all means, but in the user guide, the general note will be 1,000 hertz for scanning along the vertebrae. Thank you, Georg.
Thank you, George.
Okay. Well, if no one has any more questions, we will see you at the next webinar to be announced. Summertime in the Northern Hemisphere, so yeah. If we're betting, we've had so many days of rain in Vancouver that eventually we definitely will have sunshine. Not that I'm a betting man, but yeah, those are the odds. I hope you all have a wonderful summer. We'll look forward to seeing you next time. Thank you so much for being here today, and Georg for your lovely presentation. And yeah, we wish you all the very best. Bye-bye for now.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.
Bye-bye.
Bye.
Thank you. Bye.